7, 6, 5, 4, 3, 2, 1.
Hello, this is Dr. Daniel Pozarnsky here with Dr. Alberto Ortiz Sotomayor from the Regen Clinic in Cancun, Mexico. And I'm here in West Fargo, North Dakota at the Balance Chiropractic Clinic, renowned clinic in West Fargo. So, Alberto, we've talked a few times now, and we were just chatting about COVID and how Mexico is starting to open up a little bit more, and that 70% of Mexico is relies upon tourism from like the United States and Europe and Canada, I'm assuming. I know there's always a lot of Canadians when I travel south to like, when I've been in like Costa Rica or like the Caribbean, like the Dominican Republic and stuff like that. There's always Canadians there.
Yeah, usually they are running away from winter.
Yeah, it's always cold in Canada. So tell us a little bit about like your background in with regenerative medicine and stem cell therapy, as well as talk to us a little bit about your clinic and some. I have a list of different items that I'm interested in picking your brain about, how stem cell therapy may work with like people that have had a significant impact from the coronavirus or the COVID-19 virus, how stem cells can help people with MS, sports injuries, and spinal injuries, because that's what I specialize in, is the spine, well, actually all the joints in the body, but we get a lot of people with herniated discs, and that can, really ruin someone's life if they have a severe herniated disc, or if they have to get fusions and they lose the range of motion. They might not be able to do some of the things they love anymore, as far as like possibly golf or running or things that involve jumping or high impact. And it seems to me, when I study stem cell therapy, that is what in the future will prevent, right now at your clinic, what can help prevent, not prevent, but help heal those people so they can enjoy doing what they love to do.
Sure. Well, once again, thank you for the space, for the spot, and for the trust as well, for you and everybody who is listening to your podcast. And as you said it, my name is Alberto, and I serve as medical director here at the Rehealth Regenerative Medicine and Wortham Cells Clinic. Wortham Cells Clinic is like the sister clinic of Rehealth, where we treat pediatric patients, and Rehealth is mostly aimed for adults. So my history right here in the clinic, I have been part of the team since 2014. And prior to that, I have been working with medical tourism. However, that side was becoming a little bit boring, let's say, for me, because it was not academically or mentally stimulating.
So for like, I'm going to pause you for a second, like for people that don't know, like what is medical tourism? A lot of people haven't heard that word before.
Well, medical tourism, it's been gaining a lot of fans, whether it is from the US, from Canada, and even parts of Europe, in which some form of medical services are provided because they are somehow cheaper here or slightly cheaper, or the insurances covers them here, and also the availability of the services, because I don't know how exactly medical services run in the US and in Canada. I have some idea, but I have not been there in order for me to actually witness it completely. So
It's very complicated. Very complicated.
you have to be at the hospital in order to receive attention. I don't know if, how much in advance you have to set an appointment. I don't know how much in advance you need. I don't know, even for image testing, let's say.
Imaging, yeah.
That is, especially if insurance is not going to cover it or partially cover it. That is why medical tourism here, at least in the Caribbean, because it's a destination, a touristic destination, a nice place to be. In the meantime, you're having whatever procedure or therapy or evaluation you need. And plus the bonus that it may be cheaper or slightly cheaper. I'm not saying that it's going to be extremely cheap, but in some cases I have met patients that choose availability and readiness instead of just waiting, I don't know, let's say 6, 8, 10 months to be treated. So, and on the other side, one niche of medical tourism that is blooming tremendously is regenerative medicine and plastic surgery. We are not into plastic surgery. We may be hand in hand, but is one side is aesthetic and the other one, as you know, it's mostly regenerative anti-aging healing processes. So that's pretty much what we're focusing. Anti-aging from a non-cosmetic point of view, pretty much boosting immune system, helping our patients to deal and cope and even guide through when they are experiencing or diagnosed with conditions that currently do not have a cure, or some patients that are giving up on some medication because of the side effects. So that is where we come in. And regarding pediatric patients, well, that's a little bit of a different story. I don't want to dig into that right now, but it's pretty much offering an alternative, especially in those cases where they have pretty much exhausted almost, if not every option that it's been offered either by the insurance or the availability that they have.
Doctors in general. Yeah, insurance companies really regulate what doctors can do, as well as like the FDA in the United States is a lot more regulated than Europe or Mexico. So I know a lot of people will go to um, Central America to get different types of operations done, as far as like regenerative medicine or dentistry. And I sat next to a lady on a plane like 3 or 4 years ago. She talked to me the whole time about, and I don't think I even said a word. She just talked to me for like 3 hours straight about her sister who went to Mexico and had both her knees. She was a tennis player, and she had both her knees injected with stem cells, and got plastic surgery while she was there. So you may as well. So yeah, that does make sense. If you can get it done in the same clinic or the same city, yeah. And Cancun is pretty Americanized compared to what it like used to be. It seems like, because I was there last year. Yeah, I was there last year for a conference, and it looked just like any other city in the United States. Yeah. Yep. That is what it's like. It is kind of like a suburb right there in in right on the beach of of the city there. Yeah, totally. It's like the shopping malls and all the hotels, and it is basically like a suburb. Yeah, when I lived in the bigger city, that's what it was like. Lots of shopping. So what has the coronavirus been like in Mexico? How has that affected the population? Is it the same as the United States, or?
Well, to be honest, Uh, how has the virus been affecting the country? It's pretty much the same as in the US and maybe in some other countries in Europe. The main difference that you're going to find is the difference in terms of population or numbers. In some cases, it's going to be uh, the numbers are going to be more in, are going to cause more impact, both
Mm-hmm.
in services, unemployment, diseases, deceased people, and
Deceased.
actual confirmed cases. So
Mm-hmm.
eventually, because we received the diagnostic kits later or late, sorry,
Yep.
but that's what happened. So the ones that were actually tested with or using a PCR or a kit or something like that, the actual diagnosis takes a while, or at least in here. In the US, you now have like some form of quick testing method, and the US, I believe it's the country that has the highest rate of tests.
Yeah, and that's why we have the highest number of cases also. So it's kind of it.
I learned from a hospital in Miami, I learned that it sounds like tremendous, but also the overall population in the US is like 300 and something million people right now, if I'm not wrong. So
I think so. Yes. Nate, do you know how? Can you look up the population? Yeah, I would think that we're not. I would think that like China and where it first started, and the really overpopulated countries like even like India and and different countries like that probably, or Japan probably have a lot more cases because they're more congested with people, and that's why.
Population of how do you spell it?
Oh, intern Nate has got the
What
population
was
of.
the city name?
We're looking for the population of the United States.
Oh, just the whole. Okay, I can't hear. Right now, the population's at 328 million.
328 million is what my intern says here, and I don't know what the total number of cases is because I try not to look at the numbers because it's. Yeah. Yeah, totally. That's what I tell my patients too, because the news puts that up for like they only broadcast things that are negative mostly, so that they can get more viewers. They're making money off of having the numbers running and having the numbers higher, and so it's not healthy for people to watch the numbers and try to figure out the overall stats and try to be a armchair epidemiologist.
besides, just as I told you one of the times that we've spoken before, it's there was a moment in which everybody said, "Hey, you're just giving a negative opinion, or you're just saying words randomly because you don't have access to information." Now, today, you have whatever you look at using any device, you have access to information. And still,
Yeah.
uh, there is a lot of people who is focusing on the wrong type of information. So because of that, is that I do recommend, if you're not into that field, if there is nothing that you have to do there, my suggestion is step away from it, because
Yeah.
yeah, it's very easy to jump in that spiral in which you go down
Totally.
in negativity, and but it takes
Totally.
the same amount of strength or effort just not to jump into it.
Yeah, it's really tough. Or for me, like with Facebook being like a medical, or like medical, medically trained doctor, that to like not get into like arguments with people because there's so many things that are not correct that are going around, and I have to. It does take effort to not, for me not to look at that or to not engage because people are kind of just going to believe what they want to. It seems like a lot of times. and they can go. There's almost. I think we were talking about this last time. There's almost too much information, so they can always.
It's overwhelming, and then you're just going to pick. It's. I'll give you a very just quickly a very ridiculous example. Yet it's an example that fits this. You go to school, you have some homework, doing some research about, I don't know, history of the USA or history of whatever. You just go and Google it, history of Canada, for example. Enter.
Yep.
You're not going to take a minute even to read different titles just to find if whatever the snippets being displayed by Google are suitable for what you need. It's the traditional nature. That's why it's revenue. Um, People focus on the first three, so and usually they use number one and number two.
Yep.
What makes you think that that is actually the information that you need? But it's the one that you have ready right there immediately. It may work. You don't care, especially if you're in school, and it fits. It works. You pass. That's it. And that need of or that sense of urgency is something that is a little bit destructive, maybe, and because it's not pushing you to research a little bit more. I mean, that's my 2 cents of opinion.
I would totally agree with you because as a business owner, like and working working on my marketing, we always wanted to be number one or number two on Google, and there's a lot of ways that you can do that and not be legit. I've found, and a lot of people, it just comes down to how much money they want to spend to get there. Those aren't the best sources all the time, but they paid the most money to get to that spot or had the most resources to do it, basically. Oh yeah, yep, yeah, and those aren't good sources either. And like, I mean, even some of the sources that I trusted, like the World Health Organization, like at the beginning of this coronavirus, like they had said it's not transmissible from human to human, and they had things out like that, and I was like, how could they write something like that?
And with the regulations of using the mask, same thing
Yep.
happens if you have to use the sanitizer, whether if it's alcohol based or not, or if you can use bleach. That's the name. Bleach based products for
Yeah,
cleaning
bleach.
your house, and then you can do it with peroxide, and I don't know. So it's I believe that it's something that this is the general consent that we know about viruses in general. Let's focus on that right now. In the meantime, we dig in for more information and we will be updating down the road.
Yeah, it's totally. Yeah, with something like this, it's going to take years before they really know what it's like, all the aspects of how it infects people, and then how it spreads, and who is the most susceptible. I mean, generally we know, but like specifically, we don't.
Specifics are quite tricky. And even if
Yeah.
you
Yeah.
have them, and the specifics say that, I don't know, you have to promote loss of weight, for example, in order for you to be less prone to struggle with sequels of COVID, uh, you have to break the habit of 320 million people.
Yeah.
And that's not
Yes.
easy. It doesn't matter
Yeah.
how aggressive your campaign of your health campaign.
Yeah, like that's what like you and me as doctors are up against all the time, is trying to change people's habits, and getting them to take baby steps in the right direction. And the preventative care is what, like, I preach to people because I'm a chiropractor, and we teach more natural ways to preserve your body and to optimize it, uh, more than like taking over-the-counter like painkillers or anti-inflammatories for every, you know, every piece of pain.
You and I do understand it. Your patients may understand it. Our patients may understand it. There's always going to be one that may be a little bit reluctant. And however, I believe that the general consensus is that we know that there is medicine to fix, but nobody, as patients, is focusing on medicine as prevention. And in my opinion, prevention is both cheaper as well as an investment, because you take care of yourself when you are 30, 40, 50. That way, when you reach 70 or 75, you don't have to feel like broke up because you need a new knee or a new hip or something like that. And whereas when you are 50 and you're not taking care of yourself and keep on that abuse, or let's call it bad decisions, right? And
Yes.
and then there you reach not even 70, you reach 55 or 60, and then you wake up and your knee is cracking, or you can't wake up properly, or when you sit down, you are actually able to sit down but not to sit up, or to stand up. And and that is when people has again the sense of urgency to fix that, but it's from the functional perspective, it's late, and then you just have to repair. So and that is when things become expensive, and not only just to fix the issue, but on the mid to long term.
Yep, that's what I deal with every day. Like people wait until they're in pain or they can't function enough to do an activity they love, like playing a sport or picking up their children, or whatever their job may be, until they can't do that, and then they come in and they want to be fixed right away because they think chiropractors just will set their bone back into place and then they'll be good to go. But that's not how it works at all. Like we just improve the function, we improve the function of the body, and that helps the structure. But that is a process. It was kind of interesting what you're talking about. Well, you got to take care of yourself when you're 30, 40, 50. One of the things that I teach my, I can't say physical therapy, but because I'm not a physical therapist, and that's a law in the United States. But my therapeutic exercise patients, like when you stand up, don't push off your knees, because that's a really bad habit to start. You started when you're about 30, but you learn not to fire your quads and your glutes. And 20 years from now, like your quads and your glutes are going to be so tight, and then your hips are going to wear out. And that's how it starts. And a lot of people don't know that. But that's where I start with them when we start physical therapy.
Also, if you focus on symmetry, you're going to distort or upset the functionality on one, and then eventually your body will compensate on the other side, and then not even in the midterm, short term, you're going to start experiencing issues with the opposite side and or something else. So one problem, it's becoming 2, 3, or maybe 4.
Totally. I totally agree with that. And like the thing that I talk about every day with my patients is like your brain really can only recognize pain in one area of the body where it's worse. So like we'll get someone's neck feeling better, then they'll have low back pain because their whole body's been tight, and they'll get the low back fixed, and then their hip hurts. But yeah. Yeah, I get that is true. But we usually start with the glute muscles and the muscles that control the hip to stabilize the lower back. And a lot of people don't know that. But it's when those muscles stop working that the back pain starts, because the lower back muscles are much smaller than the glutes, and they can't stabilize the spine, so then they start spasming, and a lot of times they start spasming, or they become chronically tight, which compresses the joint, the disc, or the facets, which are the joints on the back of the spine, and that will cause inflammation, which causes the joint to break down over the time, which causes a cascade effect that people just they don't learn about that, anywhere in our education, and so it's teaching those things over and over and reminding them, and prevention is the key to having a healthy life or an active life and optimized life. And
Yeah, it's a key for aging gracefully.
yes, aging gracefully. I agree. Yes, I agree. But it's the same thing for regenerative medicine. You teach a lot of that also, correct?
Yeah, yeah, we have to focus a little bit on that. Assuming that there is a patient that comes here with anti-aging purposes, right? So at least on our end, is not just pushing stem cells and that's it. Uh, sure, they are coming here for the stem cells, but also part of the protocol is providing this necessary information, or well, personalized information, but because your needs are not going to be the same as another patient. And so we have to understand what is your diet, what are your goals, first of all, then what are your expectations, and then what can we do with the information that you are providing us in order for us to try to not exactly teach you, but maybe guide you to actually achieve your goals and or expectations. And that way you are going to be building loyalty towards what we're doing, because it's something, although the concept of stem cells has about 10 years or maybe more, and from the therapeutic perspective, it's something fairly new. So if you want your patients to trust in what they are doing, you have to guide them properly in order for them to actually feel really good. And that is exactly what we try to do. Not only the stem cells, but also providing you with information, assistance, phone calls, video calls, in order for, I don't know, 1-2 months after the treatment, how you doing, any questions, what have you been doing, and giving your feedback, right? And if you are not quite there yet where you want to be, let us understand where you are or how you're feeling in order for us to realize what can be done and what cannot be done as well. And that is also the importance of our patients going back with their physicians, because we cannot do the work, let's say telemedicine. We cannot do everything over the phone or over a video conference. Because if our focus is preventing in order for that patient to be perfectly functional when they are 70 or 80, they need also guidance over there, wherever they live. So that's where we need this. If not direct communication with their doctors, we need cooperation of the patient going back with their doctors.
Yeah. So, for instance, like if let's take for example, if I have a patient who has like a herniated disc or degenerated herniated disc, and in the United States, there's limited options of what we can do for that. Like we do physical therapy, decompression therapy, and then usually that's what I do in my office, and that can alleviate a lot of the pain, a lot of the symptoms, and help the disc heal a certain amount, but like it's always going to be weak. So if and if a patient usually doesn't want to get therapy on their, or not therapy, surgery on their spine, and they want to come to you to get stem cell therapy on a disc or on a degenerative joint, how would that work, and how does it work?
Sure. First of all, as I said, knowing the expectations and how the current situation of that patient is. Second, if they have some form of images, MRI, CT scan, X-rays, doesn't matter, in order for us to have more like a visual on how the current situation or an updated situation of a patient. Then I have to say this, we have nothing against surgery, right? So we try to offer an alternative prior to surgery, because we want, at least that's what I learned in medical school. surgery should be the last step or the last resource. Because if you go with surgery as a first option, there is always the risk to overlook some other alternatives. And especially in orthopedics surgeries, there is some form of risk in which you are not going to uh, fix the situation. Maybe you're just going to sort it out and then deal with whatever the outcome may be. Again, I have nothing against it. I have quite a few relatives of mine are actual spine surgeons, but
Oh, wow.
the idea it's exactly that, pushing away the concept of maybe focusing on a surgery as much as possible. Now, what can we do or what it's possible with this? If we are talking about degenerative disc disease or maybe some form of herniated disc, you know that there are levels of it. So if we find out that the actual hernia it's compromising the function, is causing way too much pain, and is not responding with, let's say, your approach, there is a possibility for us to consider suggesting that patient an option of surgery. Why is this? Because if they are going to spend whatever amount of cash coming here, having stem cells, going back to you, following 6, 8, 10 months of rehab or physical therapy or exercises, and the mechanical problem is still there, I rather anticipate to that and come clean with the patient, right? Because I'd rather have a happy potential patient than promising the earth and the moon and the sun and flowers to a patient, and that patient not to be happy in 3 or 6 months. And also, I don't want you to lose that patient as well. So if there is a patient that it's some form of a slight bulging disc or herniated, etc., etc., and we believe that we can inject the facets, the paravertebral muscles, and across the thoracic spine or the lumbar spine or the cervical spine, we will do it. However, we even write it down and handle this letter to the patients with some suggestions on our end on what they can start doing immediately. However, it's important for them to go back with you, because you just mentioned it a few moments ago. It's important to sustain the stability of the spine by training the muscles. In some cases, if not in most of the cases, the hernias or the degenerative disc disease is because you think you have a strong back, but you don't. And you do not tend to train your back, because if you hit the gym, you're focusing on arms, you're focusing on the butt, you're focusing on the chest, but you're not focusing on the lower back. You're not focusing on the upper back. You're not focusing on your neck. You're focusing on aesthetics, on looking good in the beach, right? But eventually, and on the other hand, if you are an office type of person, that you are sitting down for 6, 7, 8 hours, doesn't matter how expensive your chair is, you are not training your back. You are not giving some time to do some stretches. You are not giving some time to give some rest to your back. That's why, actually, if I'm not wrong, that is why this trend of using the standing desks came up, because it's important for you to every hour and a half, if I'm not wrong, every hour or so, to stand up, maybe walk a little bit, stretch, something like that. Something that another crazy guy named as or coined as office yoga or something like that.
Yeah, we have yoga. We have yoga in our clinic on Wednesday nights and Friday mornings, actually.
So and if it's something that is going to improve the strength in your back, awesome, because that's what we needed. From the stem cell perspective, your body, if the cells of your body are constantly releasing pro-inflammatory agents or markers, right, or signals, that is something that happens with the process of actually aging. So the more signals we release, the higher the damage, or the higher the weakness, or the less balance or homeostasis the body is going to find. So by injecting the stem cells locally, one of the abilities of the stem cells is actually promoting differentiation into different adult mesodermal tissues. One of them is muscle, striatal muscle. So it's possible for the stem cells to actually promote vascular formation or blood flow, as well as muscle repair by themselves. But even if you just inject them directly, you need to train that area. And that is something that the stem cells cannot do by themselves. That is where we need, let's say in this case, your cooperation and also cooperation of the patient. So that way, instead of using the stem cells as a expensive band-aid, the patient will actually feel and express improvements that are going to last more than maybe 8 months or 10 months, perhaps longer than that, right? And once again, the idea is you are doing this investment in your health. Well, keep it. It's time for you to collect what you're or to harvest what you just planted, right? So that's the important thing. Can it be done? Sure, it can, but we also need your cooperation as a patient.
And as a patient, like a patient needs to understand that by the time that you have a herniated disc, like your body has already compensated in, 3, 4, 5 different ways to try to help you, and we need to rebalance. We need to rebalance your body after you get your stem cell surgery, and the movement also helps the new cells activate and grow, I would imagine, because movement equals life.
Pretty much home into these areas. Remember that I was mentioning the signals. It's like a GPS telling you where to go. Yep. So it's pretty much the same thing. The cytokines are markers or signals for different cells to act on them. So the highest ability or the strongest property of the stem cell is immune modulation. So they are actually able to modulate the expression of pro-inflammation or pro-inflammatory markers. The most common one it's known as IL-6 or interleukin number 6, yep. And tumor necrosis factor alpha. Those are the ones, the two guys that are present in pretty much every form of inflammation in the body.
Yeah.
And if you want to cheaply measure them, there is another one known as.
That's when people hear about more because they check for that in diabetes quite a bit, C-reactive protein.
So. In autoimmune conditions, and even in people who have some form of arthrosis, regardless what it is, because it's just a marker of inflammation. So if you even want to trace how you're responding after the stem cells, even a simple test of C-reactive.
That will help you know where you're at.
That will help you know that you are actually responding to it.
Okay.
Because we perform a pre-treatment C-reactive protein here, and we give the results to the patient. And let's say when they go back to you and you are about to finish your therapy, I don't know, let's say 3, 4, 5, 6 months after, and you can prescribe another C-reactive protein, and they can see if the numbers are going up or the numbers are plateauing or perhaps going down.
And then in Mexico, as far as regenerative medicine and stem cells, you can inject them like intravenously, correct? And so would that, and you can't do that in the United States, would that help people with like diabetes? Have you ever treated people with like type 1 diabetes or type 2 for that specifically, or?
Type 1 IV infusion of cells, that there is this misconception that type 2 diabetes can improve tremendously, and some people claim that it's a possible cure, but honestly in type 2 diabetes it's not exactly like that. One of the forms of the stem cells is harvesting the stem cells from the fat, right? And this is the type of patient that I heard this. Hey, I had stem cells from the fat, and my diabetes type 2, it's pretty much cured. I can eat whatever I want. Not exactly. I mean, I am very sorry. I don't want to be a party pooper, and I don't want to burst your bubble, but I will. Why is this? Basically, type 2 diabetes, before you are depending on insulin, is pretty much insulin resistance. And if you're having a microliposuction in order for whatever place to work with that fat, collect some form of stem cells, and then infusing them to you, they have to remove 60, 70, 80, 100 cc of fat. So pretty much immediately or instantly in 20, 30 minutes, you are losing 100 cc of fat. So you are reducing the insulin resistance. So that's why, plus the infusion of the stromal vascular fraction, which is what you can get from the fat in about a couple of hours, you feel some improvements because you are pretty much losing some form of weight, or in this case, fat, and improving the insulin usage, not the production, the actual using the insulin that you're producing. And therefore, your results or your blood work is going to come pretty nice if you compare them with your previous ones.
Yeah.
Yes.
On the other hand, type 1 diabetes, the mesenchymal stem cells can be very helpful if, or mostly if, the patient is in something known as honeymoon phase. Honeymoon phase, it's a state in which the pancreas of that patient is still producing some insulin. Even if it's, let's say, out of 100% of the pancreas, even if you have 20% still producing some insulin, should be enough for the stem cells to modulate the autoimmune part or the autoimmune trigger of the type 1 diabetes, and your body can somehow learn to work with that 20% of pancreatic function in terms of insulin production. So that's why those patients, after having the stem cells, if we catch them in this phase, they can stay like that without needing the insulin or depending on insulin or exogenous insulin for something between 10 months to a year, up to maybe 5 or 6 years, until the actual autoimmune part or the autoimmune trigger pretty much beats the pancreas, so you are producing enough.
Yes. Yeah, there's a lot of people in their early 20s. They usually get, a lot of people with type 1 diabetes, unless you're very young, like get diagnosed with type 2 first. And it's really they're in that honeymoon phase where the pancreas is getting broken down. And then it can be in the late teens or the like I had a friend who was, I don't know, I suppose like 30 before she actually got the type 1 diagnosis. But it's very expensive after you have to start taking insulin every day in the United States. It's like, I think it's something like $2,000 a month for your insulin. So stem cell therapy could be something that could be really helpful if you catch it soon enough, it sounds like.
I had a case of a 40-year-old kid that was diagnosed with type 1 diabetes. Fortunately, she responded well. Unfortunately, they didn't change the habits of the family. So the actual effects lasted for maybe 6, 7 months. On the plus side, she went from 30 units of insulin per day to 0 for that period of time. But again, if you don't change your habits, I mean, she pretty much, with all the respect for the family, at 40 years old, at 40 years of age, you have no opinion whatsoever in your house. So you do what your mom tells you to do, or you eat what everybody's eating, etc., etc. Yep. So maybe it's a family thing. I don't know. I'm not questioning anything, but that's the importance of us trying to convey. It is important, for example, in that particular patient, to design some form of a special diet, maybe complex carbs, very small amount of complex carbs, non-processed food, maybe staying away from everything that has refined flour or sugar or anything like that, no sodas, etc., etc. It's like a Zen diet.
Like a paleo diet.
Yeah, exactly. And in order for that patient to pretty much feel healthy without increasing or depending way too much on insulin, if you catch them in these early stages.
That's really good to know, because, yeah, if people could get treatment with stem cells and change their habits, that could really be helpful for people in that honeymoon phase of type 1 diabetes. I'm going to remember that. Glad we brought that up. Because, yeah, it's tough once you get it, once you lose the use of your pancreas. And over time, it's really hard on your body, all of your cells.
There is also another side that affects pretty much every patient when you are not able to perform, be, act, eat, uh, whatever other adjective that I'm missing at the moment, the way you used to do it before, and that's psychologically.
Yeah.
You just said it yourself when you were asking about the herniated discs and whatnot. For example, a lady that likes gardening and then they cannot do any more gardening because the knee is busted somehow. It may be slightly depressing because maybe she loves roses and she loves taking care of her garden
Oh, yeah.
and she can't.
That's huge
So
here in North Dakota, and I have patients that are exactly like that. Like their knees are bone on bone, or their hips. Usually starts with the knees and then the hips um, wear out, and then they can't do that anymore, and then they're more sedentary and they get more ill, or they have to. A lot of times in the United States, they wait too long actually to do the replacement. They waited almost 5 years too long. So then the other side of your body has compensated too much. And now the trend is like with knees, they'll just replace both of them, like a 2-for-1 special. And that's really hard recovery. And you're never the same again. You lose range of motion. It's hard to kneel still. So regenerative, like stem cell therapy would be very helpful in that aspect also.
yeah, they can, as long as they have a little bit of cartilage left, they can. The results can be very promising for them, both in pain and function.
Yeah, yeah, pain is the big thing too, because then they can't sleep, and then that affects your whole body, your whole system. Does what was I going to talk? How much cartilage has to be left for successful stem cell treatment, like in your knee or in your hip,
Usually, don't get me wrong,
spine?
but there is not like a minimum amount of cartilage.
Hmm.
You need some form of cartilage in order for the cells to home in place and form some and attach to it. But uh, you also need space. So if the space is completely closed,
Hmm.
uh, the stem cells still can be useful, but there is another concept that has to be taken in consideration, and that is some form of decompression or surgical decompression in
Hmm.
order for you to open up a little bit the space or make some space and then inject the cells locally. Our goal from the tourism point of view, because we cannot do that in 3 or 5 days, that requires quite a longer amount of time. Um, we try to catch them when they are complaining, when there are maybe some osteophytes present in there, when maybe there is a slight rubbing, there is a lot of pain, maybe knee inflammation, physical, actual knee, visual inflammation, we can do it. If the knee is completely rubbing, the
Hmm.
stem cells still can be useful, but we do not address that here because both prices stay, travel, the actual transportation of the patient, and the time that the patient should be here is completely different. So it's a completely different protocol that is slightly out of our hands because of the surgical part.
Could one of my patients, that's interesting. So could one of my patients, let's say they were thinking about a knee replacement. Usually they put it off because they don't want to get that. But if we did, let's say we did decompression therapy on the knee along with rehab, like for 3 months before they came to see you, would that be enough time or be helpful to create that space?
It's just a matter to take, literally to take a peek, an X-ray or some form of image testing should
Hmm.
be enough. As long as, again, as long as there is some space for us to push some volume,
Hmm.
there are possibilities for it to work, honestly.
Okay, okay, that's really good to know also. And then in the United States, like a lot of people, not a lot of people, but I hear about people trying, or they'll get it too late, the stem cell therapy. We can't create as many stem cells here in our clinics as you can in your clinic because of the FDA regulations. We can't grow or change the tissue
Yeah, the
outside of the
expansion.
body. Um, yeah, we can't expand the stem cells. So a lot of people will, you know, pay $5,000, $10,000 and get it in their knee or hip when they're 60, but again, they don't do any therapy before the decompression that you're talking about. Like a doctor basically just, gives them stem cells and sends them on their way. Like I've never heard of a clinic that I've, around our area at least, that does any type of therapy afterwards. They just, recommend, they just give them a shot of the stem cells where they get them here is they get them from umbilical cord tissue from babies from biologics labs, but those can't be changed. They don't usually take, what I've been studying, because we're going to do like PRP therapy, or start doing PRP therapy here in the next year or so, and I've been studying quite a bit. But they'll buy the umbilical cord cells from a lab that haven't been changed, so it's within FDA guidelines, and inject those. But it's still not enough in terms of the volume of cells compared to what you can do. Correct? Is that correct?
Yeah, you are somehow correct. I know some laboratories over there in the US that sell the cells that you are claiming, that you're mentioning. I know some other clinics that they perform bedside process of a quick bone marrow collection to treat the patients using the hematopoietic form of the stem cell or from the bone marrow, and still inject them. They can actually achieve some good results. Again, quick disclaimer, I'm not bashing anyone. Actually, that's not my objective. But it's true, there are very few places that suggest homework to their patients after they spend $1 or $100,000, doesn't matter. If you want, my personal idea or vision is that if you want a little bit of loyalty from your patient, you have to show a little bit of care post-treatment. So that's why we cannot be completely behind them, but if we have some support of them through their doctors, that's phenomenal, because they have to achieve they can achieve their goal by following, let's say, the exercises that you provide. It's important, yes, because of the same reason that I mentioned earlier. You have to train the area, you have to push or to stress, let's say, that area into pushing your immune system to activate or to work or to push the formation or the regeneration of that site. The stem cells alone by themselves, they can control inflammation, they can bring comfort in terms of pain, they can improve your overall health sensation, sure. But if you don't do anything else, if you don't do your some changes in your life or in your lifestyle, sorry, you will be exactly the same person that is constantly bombarding your body with agents that promote inflammation, whether if it's diet, as ridiculous as it may sound. It could be diet, could be bad.
Diet's huge for
diet's
systemic
huge.
inflammation.
Yeah.
Like, because the American diet, I'm not gonna say we, because I don't, but like on average, like studies show that we eat 70% carbohydrates in our diet. Like we have that McDonald's culture. It's changing slowly, but too late.
Don't get me wrong. I have nothing against fast food because it's convenient. It's a nice cheat every once in a while, but nobody's forcing anyone to eat fast food every day, which is a problem. So because it's convenient, it's quick.
Convenience is the problem.
So we are focusing on convenience instead of health. So if, for example, if you eat McDonald's 4 times a week, because it's cheap, I don't know how much you can spend per person in McDonald's. Let's say $7, 4 times a week, it's $30 a week. And you are saving going to a restaurant, you're saving doing some groceries, you're saving on cooking, you're saving on gas consumption, blah, blah, blah. So may sound cheaper, but in your body, you're just pushing the release of these inflammatory factors, whether if it's through the stomach or the flora, the gastrointestinal function, and this eventually is going to disturb your immune system. And if you add to it that you have a bad knee, and then you're eating this crap
Yep.
every day, you will be gaining weight. And you know that weight is not excessive weight or obesity is not very good friends with knee problems or hip problems.
Oh no,
So
that's what people try to do once it's too late. They try to start losing the weight, and it's too late. You know.
they may feel a little bit okay, right? But
Hmm.
the problem is done. And now you have to work on 2 or maybe 3 different things and not only the hip.
Yeah, exactly, exactly. But that's where you can with stem cell therapy, like you can start turning things around. Like if you are, motivated enough to do it. Which, if you invest
Because,
in the therapy, like you should be motivated to change.
and
Um,
also, if I may compliment, that is the nature of doing the IV infusion of the cells.
mhm.
Not only the knee, the hip, or the back, or the neck. It's whatever the needed area plus the IV infusion of the cells, because IV infusion helps with that systemic inflammation.
Yeah, it just takes a total stress off of the
Mhm.
body, so then it can work optimally, so those stem cells can grow and multiply and do what you want them to do or what the patient wants them to do. Correct?
Yet again, the fact that you're feeling okay or better does not mean that you can do whatever you want. I mean, if you see it as an investment, you're going to make a change. If you
Uh-huh.
see it as a expense that you can do every, I don't know, 6 or 8 months, okay, go ahead. But that's not the point, right?
Yeah, exactly. And that's not, most people don't, have the funds or resources to do stem cell therapy, every 6 months unless you're quite rich.
Exactly.
Because it's not necessarily cheap, but I would say
It's
definitely.
cheaper than a hip. It's cheaper than a new hip,
Uh-huh. Oh, it is.
but both in cash and in sensation and in aftermath and in
Oh,
discomfort.
totally,
But
totally, yeah.
if again, I think that it depends on how the patient absorbs the actual value, not the cost, but the value of any medical procedure, not only stem cells.
Yeah, like for myself, I've had actually quite a few surgeries because I like to play sports and be active. I'm a little bit of a adrenaline junkie, and each time I've had 2 knee surgeries and 2 shoulder surgeries, and each time they only like after a surgery though, the insurance will only usually allow like 6 weeks of physical therapy, but really it takes a year to heal from a surgery, and most people don't know that. And I tell my patients that too. Um, so I always go work with specific trainers in Fargo over at the Sanford Power Center. Shout out to them. They're the best trainers and the best kid secret in town, I think. But they've helped me a lot over the last 10 years as far as me being able to I like to do amateur boxing and mountain biking, and allowed me to keep doing those things and get back to running a little bit, even though I do need to get some stem cell therapy in my knee to do that to the potential that I would like to. Um, what about so there's stem cell therapy. Let's go back to the immune system a little bit because last time we were talking about um, how people that were affected negatively, or they had a really hard time with the coronavirus. It affects your kidneys, it affects your heart, it affects your lungs. That stem cells can actually help that, and some emergency situations can prevent death.
Yep. Overall, coronavirus, if you're positive to it, but no symptoms, we don't suggest them, right?
Hmm.
However, there is a group of or a population of patients that they are positive to the coronavirus, and eventually they start to present symptoms that are related to acute respiratory distress syndrome, in which they are having trouble breathing, getting oxygen in, actually using or mobilizing that oxygen, and that's when they depend on being intubated. In that stage is where the cells are currently considered as a potential option, both to get out of the ICU as quick as possible instead of being there for 2 or 3 weeks, and second, perhaps leaving the hospital a quicker as well, right? So how in this particular phase or stage, how the cells work, there is something that the virus causes in the body that is known as cytokine storm. Pretty much, the virus causes so much inflammation that releases, I was mentioning earlier about the C-reactive protein and the interleukin-6 and the tumor necrosis factor alpha. Well, the virus releases so much of those plus another 3 factors that it starts to cause something known as organic failure. So does not matter how much steroids or that way that we're trying hydroxychloroquine or chloroquine and some other immune suppressors, and they were not having exactly the best results while in trying to suppress or to control this cytokine storm. And that's how eventually the cytokine storm calms down, and is when the patient leaves ICU and it's a survivor, and or I'm sorry for how they sound, or the patient has the potential to die. So currently there are a couple of us.
It's like within,
it's fast.
So fast, that's why it catches people.
Yeah.
Surprised.
There are cases in which they start experiencing symptoms on day number 10, and by day number 12, they are already intubated.
2-3 days.
Or maybe in 24 hours.
Yep.
So when they are in that stage is where the stem cells have actually proven to be useful to help controlling that cytokine storm. Therefore, the patient stays in the ICU for less time and actually moves out to I don't know, not ICU, and then release it, and then they are discharged. There is a clinical study going on right now in the US. We would like to work on something similar in here, but protocols and bureaucracy is slightly different here than over there.
Yeah.
However, what can be done or what we can focus on, and that this is my personal perspective on what it's coming about regenerative medicine, at least for the following 6, maybe 8 months, it's helping or treating patients that are actual survivors of that stage of the coronavirus. There are usually 3 parts or 3 things or areas that a patient can struggle with after having coronavirus in such stage. One, it's cardiovascular problems that they tend to experience some thromboembolic events, and there is a potential of having a stroke.
Yep.
We can treat patients with a stroke or that had a stroke using stem cells, because the stem cells, as I said before, stem cells have the ability to promote differentiation of blood vessels. So you can actually aim, or the stem cells can actually push oxygen and promote some vascular formation in, it's known as penumbra area, or the gray area, in which the tissue is not completely gone, but it's struggling for oxygen. And I think that some oxygen is better than no oxygen, right?
Yeah.
So I mean, sounds like stupid, but it is, right? It's important. And plus you complement it with IV infusion of cells for the actual inflammation that is being caused by the lack of oxygen flow. So that's one. Second, the other part is the most important and the most common, which is pulmonary function. You are a survivor of the coronavirus. It's very likely that you can lose or you may have some compromise between 10 up to 30% of pulmonary function. So, and you can actually notice it because maybe you cannot go up the stairs as quick as before the event, right? If you were intubated, it's known currently, due to the massive amount of studies that have been released thanks to coronavirus, that thanks to the situation, you're struggling for oxygen when you're in ICU, and the only way to push more oxygen is through a tube, right?
Yep.
However, the oxygen going in is not the problem, but mobilizing it. So eventually, being intubated with coronavirus only, not for every condition. I'm
Yep.
talking about coronavirus. It may cause some form of fibrosis or inflammation or some degree of compromise of the alveoli in the lungs. So eventually, you will be inhaling, let's say, 1,000 cc of air, but you will be working with 700. So in this aspect, the IV infusion of the cells, it's phenomenal because the first pit stop of the cells, it's in the lungs. You're putting the cells in the vein, and in order for those cells to reach the arteries, they have to go through the pulmonary network from the venous blood to the arterial blood. And the cells actually home in the lung. There is a phenomenon known as pulmonary sequestration or cellular sequestration. Pretty much is like a kidnapping or some of the cells in this area, because it's a network, and some of them may just stay there and the rest may go through.
And that has to do with the different inflammatory markers are. They home in on those, correct?
Yes, for both mechanically and by markers. So eventually, the cells can actually reduce inflammation, so the patient can actually improve somehow between 5 up to 15, maybe 20% in pulmonary function. Very similar to the results that we have been noticing in patients with COPD. Now, and the other one, it's some form of neurological problems, and in some cases, small amount, but still kidney problems, in which that is because the receptors of the virus, it's of the ACE2, angiotensin.
Yep, ACE2.
ACE2 receptors. We have a lot of receptors in the kidneys as well. So there are some patients that may remain with some form of neurological compromise, such as anosmia or trouble to smell, and or in Spanish is dysgeusia, which is trouble for tasting properly, and that will prevail pretty much. So I'm not saying that
that's why that's one of the symptoms is the numbness.
Yes, that is one of the symptoms, but depending how aggressive the situation is in the patient, there are patients that remain like that for 3 or 4 months, or may remain like that for a substantial amount of time. There are some patients that gain the smell and the taste back in a couple of days.
So it must also attack like some neurologic tissue receptors, like the hypoglossal nerve and facial nerve, or not.
Actually, the ACE2 receptor, it's present. When I went to school, we thought that we only had it in the lungs and in the heart. That's why some sort of cardiac insufficiency, which is another area where the stem cells can come into play, and therefore pulmonary hypertension. And that's where we were focusing the most. However, thanks to coronavirus, I learned, I'm not saying that is something new, but I learned that, or relearned, that we have ACE2 receptors pretty much lungs, heart, intestines, kidneys, olfactory bulb, and I'm missing another spot. So that's why the patients are experiencing ridiculous symptoms like no smell or diarrhea.
Yep.
And they don't pay attention to it. Maybe they just do some sort of home quarantine, but there is always a possibility for those symptoms to pretty much become nasty, and then you end up in the hospital. So
why do you think, like, I think it's less than 1% of people that actually have the cytokine storm, but what do you think predisposes them to that?
Well, the comorbidities, the most common one is obesity, blood pressure issues, heart condition. Those are the highest, and diabetes. Those are the most, especially if the diabetic patient is not treated correctly or taking the medication or treating themselves correctly, because you are pretty much overexposing the receptors for the virus. So that's the reason why in China and Italy, the population that was considered to be or to die, let's say the population that was dying the most
Yep.
was between 70 to 80.
Yes.
However, when
That's similar in like my North Dakota, our state. Like I haven't heard of any younger people getting really sick.
yeah, but for example, here in Mexico, the population that it's dying is between 35 to 45, maybe 50.
Oh, really?
And that is just because blood pressure issues, diabetes, and obesity. I don't know if today Mexico is number 1 or number 2 in terms of obesity in the world, which is not something to be very proud of, but that is the reason why scientists are considering that from 70 or 80 years of age over there in Asia and Europe, here we thought that it was going to be the same, but no, we overlooked a couple of things and eventually, and that's something that maybe happened in some spots in the US, and in Europe was not that aggressive in such productive ages. But here in Mexico, in Latin America, it struck tremendously.
Oh, well, yeah. Yeah, obesity, hypertension, those are two of the symptoms that we were warned about to warn our patients of. Do you think there's a genetic factor involved, or
perhaps there is always a genetic factor.
Yeah, because there's say there's no comorbidities, but there's always got to be a comorbidity, because like an actual person with a healthy, like most people survive, and most people, like young people especially, like they hardly notice that they get it. So there's a lot of comorbidities that people don't actually know that they have. And then they just say, oh, you can just die suddenly, but there's in medicine, like there's usually always a reason. You just got to dig deeper.
And in some cases, for example, the health personnel, there is a history of a nurse, male nurse that used to be a bodybuilder, very fit, tall, strong guy, nurse. He got infected and he had a really bad time. And physically, he was phenomenal. But I don't know if in such case or the cases of the health personnel that
aesthetically, at least. Like that's
at least
look at aesthetically.
Exactly, aesthetically. Maybe physically he was not exactly the best, but I don't know. But I don't know if it also has to do with the fact that health personnel that is in the COVID areas are constantly dealing or treating with more than one patient. So I don't know if there is some form of overexposure, to be honest. I cannot confirm that. Yeah.
I would think that just fatigue. And then there's another thing I was just reading about, like central nervous system fatigue. That usually happens in people that like do like marathons. Like I've ran like 5 marathons in the past when I could run before. But like those are some of the people that are getting it also. And I wonder if it's not because like their nervous system is run down and they're fatigued in that way, which affects their immune system. There's just some ideas that I've had.
Besides, even stress can compromise your immune system. So any virus or pretty much any disease just needs a small window of opportunity to do its job. So if that's why the at least my rationale behind the suggestion that I gave you or that I mentioned to you earlier, stay away from the toxic, let's say, news or this, because there is always going to be one person that overstress about pretty much everything, and
totally.
That is a huge factor, honestly.
Yeah, I totally agree with you on that point. Yeah, it was kind of funny. Like some people, like we're having riots here in the United States lately, and then people are like, I thought COVID was over because we have riots now. That's not how it works.
No, I think that what happened is that the riots and the whole this whole movement,
different.
Exactly, were bombarding the news so much that COVID went from this size to maybe this size because then the Rehealth was this size.
Yeah,
So it
exactly.
was, the attention is different.
There's two more things that I wanted to talk about before like we end the show tonight, like natural killer cells for cancer therapies and chemotherapy, like or to help recover after chemotherapy, and then like exosomes. Like what are the exosomes used for exactly? That's another thing that kind of can help boost people's immune system.
Sure. Well, natural killer cell therapy. Quickly, natural killer cell is a form of a white cell, part of the innate immune system. So the job of the natural killer cell is pretty much check on every single cell of your body. And what they have to do is pretty much find a cell that is lazy without providing any functionality to the body, or a cell that is compromised either by virus or usually viruses. And so these cells are known as senescent cells. So a senescent cell is pretty much a cell that is just there without chipping in at all, right? So it's just using space, using resources, consuming resources, but not giving anything back. So my personal thinking about the NK cell therapy is the natural killer cells believe or follow the orders of the immune system that it's cheaper for the immune system to get rid of these senescent or unnecessary cells than keeping them alive. So by wiping them out, you are pretty much keeping the actual functional cells. From the aging or anti-aging perspective, this is something that it's very useful because the less senescent cells, the better the performance or the better the balance or homeostasis of the body, regardless of the age. In terms of cancer patients, a cancer cell is a cell that tends to grow very quickly, depending on the form of cancer, regardless if it's benign or a malign type of tissue. Naturally, a cancer cell, it's a cell that, as I said, grows so quick that may outnumber your natural killer cells. So your NK cell is still doing its job, but they don't have enough army to surround or control the issue. If you are exposed or overexposed, then it's when the cancer gets bigger and bigger and bigger and bigger. Now, NK cell therapy as cancer treatment is not a cure. It's mostly like a coadjuvant, especially in early stages of cancer, to contain the situation. In the meantime, those patients are having chemotherapy or radiotherapy or even a resection of the tumor, right? It's an alternative, especially for those patients that don't like the concept of chemo or radio as well. And they have recently diagnosed with some form of cancer, even if it's a small one, stage 1, very steady, not growing, etc., etc. And perhaps you heard this before. I don't like medication because it's too aggressive, because it is
yeah, especially chemotherapy.
Chemotherapy is very invasive, etc., etc. So NK cell therapy could be an option, right? In order to contain, and in some cases to, I'm not saying again curing, but maybe limiting the tumor or the
help the body fight.
Exactly, to fight the production of these cells. That's like the overall conception of the treatment. It also can be of use for those patients with Lyme disease.
Getting more common in the United States.
Yeah, it's very, very common, and nowadays it's very common. However, those patients needs to be evaluated a little bit better, because we've had different experiences, positive and not so positive. I don't like to say negative, because every patient experiences something positive, but some patients experience really good things, and some patients just things, right? So it's important to understand if the patient has some form of autoimmunity. It's important to understand how the virus levels of the patients may be, and if the patient is actually being diagnosed with Lyme disease. And now, in terms of exosomes, Exosomes is something that is currently available somehow in the US because it's not that regulated. And, but there's also a little bit of confusion about them. Exosomes are pretty much a vesicle that is being released by a cell. One cell can release, let's say, 100 or 200 exosomes. What it is pretty much the fusion of a cell compartment with the cytoplasm of the cell. So it forms a tiny sac that is released. Now, what it does, pretty much exosomes are a form of hypercommunication between cells. There are good exosomes and there are bad exosomes. Even cancer cells can release bad exosomes. Our objective is harvesting exosomes from the stem cells. When you have stem cells, there is something that takes place within the first 2 to maybe 4 days that is known as paracrine effect. It's a stage in which a patient feels really good and they claim, hey, I feel fantastic, I have no pain, my autoimmune condition, whatever it is, I barely feel it, etc., etc. Again, I don't like to be the bad guy, but don't get overexcited. This is something known as paracrine effect. It means it may show you how you may feel on the long term, but it doesn't mean that you're going to feel exactly like that forever.
Yeah.
So
awesome.
Exosomes, it's exactly they are known to express the trophic factors or the markers that are part of the paracrine effect.
Oh.
So pretty much, for example, you can inject exosomes in a articulation, and the patient is going to feel really good pretty much in 3 days, let's say. The effects are quicker than with the stem cells, but they are not stem cells. They are just going to bring some relief. The effect is going to be more immediate, but they will not represent some form of regeneration like with the stem cells. It's like releasing the exosomes to pave the road for the stem cells. So there are patients that are very happy using exosomes. Fantastic. If it works for you, that's fine, right?
But is the joint still getting? Is it more? Does it actually regenerate anything, exosomes, or is it just?
No.
It doesn't.
No, the exosome will not actually regenerate. They may push the release, or they may modulate the inflammatory factors locally, and then your overall natural production of cells can do its job, right? But that's why I'm saying that they pretty much pave the road for your immune system to work better. And however, it also depends on your immune system, on your natural production of cells, and your current health of the articulation or the area that you're injecting the exosomes in. And so on our end, the recommendation is you're having the exosomes in your articulation, have the IV stem cells, right? Because then you need also the immune system modulation systemically. So overall, that is what exosomes are right now. Because of the size, they have very nice potential. And I'm pretty sure that in the future, they are going to be used as vehicles to either for medication or for some other form of genetic engineering or something like that. And because they have the potential to improve communication between cells.
I'm really curious. I haven't had a chance to study those a lot, but that's a question I want to know a little bit more about. So thank you for that. We're about at the end of our time for the show today. Is there anything else you'd like to add about your clinic? Oh, I know you have an amazing concierge service. If when patients come down there for your treatments that you offer.
Yes. Actually, whomever is listening to this conversation and wants to know more about us, we have a free patient evaluation process. Again, I like to emphasize on the free part because once again, I know that it's going to sound repetitive, but everybody is different. Therefore, needs are different. Therefore, if we're talking about personalized treatment, the help has to be personalized as well. So we already provided you with the link. So anybody can
Yep, we'll
click
put
on
that in
your
the show notes and on our
on
website.
they can click on those links. Those links are
will.
going to guide the people who is inquiring about this to fill a quick questionnaire. The questionnaire is not for me just because I'm nosy. It's mostly for me to understand the condition of the people who is asking information, right? It's not that I don't like to explain things in general, but general is not enough if when we are talking about an individual. So once we know what the issue or the condition of this patient is, we communicate with them, whether if it's over the phone or video conferences. I personally like video calls more because it makes them more personal, and also I think that it helps to grow some level of trust at least. And if the patient, yeah, exactly, you will when it's the first step of the relationship, and we explain them. The objective is mostly educational, is going through what they can expect, what they are going to feel, how the treatment takes place, where we are located, where the stem cells are coming from. Addressing their concerns, addressing travel concerns, etc., etc. So once a patient is satisfied in terms of information, if that patient decides to move forward with the treatment, we have everything sorted for them because, as you said, our concierge department has to communicate with them to know if they have some special needs. I don't know, let's say that something ridiculous. I like almond milk, for example, right? And I haven't been to Cancun. Where can I get it? Don't worry. Either we can set an appointment with the concierge services to take you to some organic grocery shopping if you want to, or
when I get my therapy done there, I'm gonna have a bunch of really ridiculous requests.
As long as it's something viable,
watermelon cut to tiny chunks.
As long as it's something viable, that's not a problem. And because it happens, I mean, there are patients that say, "Hey, I like to cook my own food, but the hotel doesn't have a blender. Can you help me with one?" Sure.
Oh, great.
So, Cancun here is quite large. There is like 16 or 17 miles of hotels just in Cancun. So there are hotels that are all inclusive. There are hotels that are European service, European style, or something like that. There are hotels that have a full kitchen in them. That way you can do whatever you want in terms of food.
There's a very nice
alternatives. There are a lot of them, and because there are a lot of them, there are patients that say, "I don't know where to stay." So concierge can assist you with that.
Yeah, so that's very helpful.
We try to provide peace of mind, which is one of the most important and expensive things.
Especially since I've never been there, then that helped quite a bit.
And also, if you're going overseas for a therapy.
Yeah, that's people get nervous about that. I know.
Right.
All right. Well, that wraps up our show for tonight. Thank you again for coming on our show, Alberto, and answering all of our questions. I could probably talk about this for hours and hours.
It's a fascinating field.
Yeah, it's fascinating and it's growing. So we appreciate your time and sharing with us your knowledge very, very much. And we'll get this out to as many people as we can so we can help and change as many people's lives as possible.